Hello, welcome back again. Welcome to Aspire Education and myself, Dr. Ankur Garg. And today we have got Dr. Iqra Ahmad with us, and she'll be discussing a lot of things about GP training because a lot of candidates actually do ask us how to go about the GP training. So briefly, I'll tell you like what we are going to discuss, and then I'll give command to Dr. Iqra. So first of all, she'll be discussing briefly about the PLAB and job hunting. I mean, how many jobs did she apply, how many she got, and why did she choose that particular job, and what was the pressure she was having in the new jobs, how did she apply for the GP training, the application, the FY2 competency, how did she went through the MSRA, the interview, the GP rotation she had in the last 1 year as she is a second year trainee, and we'll discuss briefly about the GP exams as well. So that's all about, and all the users, all the viewers, those who are seeing this session, you can write down your questions as well. So we'll be taking the questions somewhere in the middle or at the end of the session. Okay, Dr. Iqra. So she's working in East Essex Hospital, and she's a second year trainee. So Iqra, up to you now. It's all towards you. Yeah.
Well, thank you so much for this opportunity. I wanted to do this with you because when I started PLAB, when I thought of PLAB, all what was available to me was blogs and online things. I could not speak to anyone face to face, so I had no, direct guidance. So I had to put in so much of my time just trying to find out about things, how they go, and where should I apply and where should I not apply. So I thought this is a very good platform for us and for other people as well to help them.
Right.
So
right.
Yeah.
Yeah, that's true. Like she's very much right. Like when she did PLAB, maybe I think a couple of years ago, lots of blogs are available. That's true. But the things like video things or face-to-face like this, the one we are doing today, these things were lacking. But now we're trying our best to help all the international medical graduates. That's true.
Yeah. So I'll start with, I'll briefly say about IELTS as well, because a lot of people face difficulties in IELTS as well.
Yeah, so, definitely.
Yeah. So IELTS, I would say most of the people face difficulty in writing section. They are okay with everything, but they writing section. So in IELTS, I think you have to score 7 in each section and 7.5 overall in order to sit in PLAB exam. So you have listening, writing, and then you have conversation as well. But all of this is fine. The writing section is what people face difficulty in. So from my experience, what I think is that obviously we speak and we read English throughout our life. So it's people think that why are they not being able to clear IELTS, or why is it so difficult? What I think is, what they are looking for in writing section is if you have written in the correct format, and if you have used complex grammar. So there are always different ways of saying or writing a sentence. If you're using a complex grammar and if you're following a right format, you'll go through IELTS. I was able to go through IELTS in the first time, and that's what I followed. I did not join any academy. I did not do any course. I practiced, but I practiced myself. I again spent a lot of time into looking what actually they want from us. They don't want us to write essays, long essays. It's a format. After getting done with IELTS, the next step is PLAB 1. So I think before everything else, what you have to do is you have to plan ahead, because whole of this process is going to take time. It's not a 1 or 2 month process. It's going to take a couple of years. And obviously you have to have a plan B at the back of your mind as well. What if you don't, clear in one go? So PLAB 1, I think you can appear only twice in a year. Uh, that is how it is in Pakistan, where I am from. So you can only sit it twice in a year. I think once in March and once in November. So if you're not able to go through both years, you have to wait for another year. So that's a lot of time consuming process. So you have to plan ahead things. I would suggest, when you are doing your house job or your first year of your internship, start sitting for your exams, start preparing for your exams. That's what I did. I did my IELTS and PLAB 1 in first year of my internship. And by the end of my first year of internship, I was ready to come to UK and sit my PLAB 2 exam. So I made sure I have not wasted any of my time. I was enough, but I planned ahead as well. I had time. If I knew, I have to have enough time if, God forbid, I don't pass the first attempt. So there are a couple of online question banks available for PLAB 1. You just have to go through the questions. It's basically what all of us learn in final year. So it's a mixture of everything. All you get medicine questions, you get gynae question, you get ped questions. So it's only medicine. It's mixture of all the specialities that you would be asked about in PLAB 1 exam. It's a 200 questions exam, and the main factor which most people find difficult is time, because you only have less than a minute for a question, around 50 seconds for a question, to read through the question and then to answer the question. So I would say, apart from preparing well for the exam, what you have to do, what you have to make sure is you do enough mock exams as well, to familiarize yourself with the exam pressure, with the exam environment, so that when you're actually seated in the exam, you would have the idea how much time you would have. When I remember when I sat my PLAB 1 exam, I was I think I had 20 to 30 questions that were still left, and only 10 minutes were left. So I just blankly filled in the answers, because and the exam, my invigilator kept on telling me that you have left so many questions in between. Make sure you do them, because from our experience, we are telling you, you won't get enough time. And I didn't listen to her. I was like, no, I know what to put at the back of the mind, and I would be able to do it. But then I couldn't. I did, I did fill in everything, but I didn't read the questions, and I just filled in the MCQs blankly. So that's what I felt, that you have to be careful about. Just prepare well. I used 1700 MCQ bank. I did those 1700 questions along with some text. I read my final year books again, just briefly. Or Oxford Handbook is a nice source for reading stuff. And then you can always, as I mentioned, there are 1700 questions online available everywhere. Just go through them and then do mock exams as much as you can, because that's where you would know how the exam is going to be. And when you actually, start doing your questions, thinking that you are in an exam setting, that's where you know if you would be able to do it or no. It's not about clinical only. It's about how well you are with your time management as well. So that's your PLAB 1. After PLAB 1, another big hurdle for international graduates is visa applications. People have to take out time to apply for visas and all of that, and they have to wait for their visas to come back. And once everything is done, then you come here for your PLAB 2 exam. So again, as I said, I would say this throughout my conversation: plan ahead. Time management is the key, and you have to be clear what you have to do, and when you have to do it, and always have plan B with you, because you know, if things might not go as you have thought them to be, you would be disappointed if you don't have plan B, and then you would have to spend more time thinking about how to go about and how to go around things. So always have plan B. Always know when and where the exams are available. If not in your country, where else you can go. That's I'm talking about PLAB 1 here. And how to, you know, do things if they are not going as you have thought, or as you have planned. So PLAB 2, after you're done with your visa process, you have to do your PLAB 2. So it's a patient and doctor interaction exam, where you have 18 stations, if I'm not wrong.
Yes, actually, yes, 18 stations actually, but now they have introduced this socially distanced PLAB 2, so they will be having only 15, maybe for next couple of months.
Okay. Yeah, so it's a patient interactive exam where you have 18 or 15 stations, you have examiner in each station, and 8 minutes or 10 minutes.
It's 8 minutes. Like a station is 8 minutes. Like you will be getting say 1.5 minutes to read the task, and then 8 minutes inside. So in total, it's like 9 minutes and 30 seconds.
Yeah. So you have 8 minutes where you have to take history, you have to give management, and so you have to take history, give diagnosis, and give management to the patient.
Right. So as in, like in PLAB 2, like we have got scenario for all the kinds of things, like if it is related to medicine, surgery, gynae, pediatrics, ethics, counseling, everything. And the most important thing is you will see most of the scenario, you will be working, say, in GP, you are applied to GP. So lots of people, they are like interested, like what is GP and how to become a GP. So that's also like
very interesting, because here, in a GP setting, in a real world as well, you only have 10 minutes for each patient.
Yeah,
so it's
I think that's why they're preparing us, you know, from exam itself by giving us this time-bound consultations.
Yeah. So as I mentioned, in real world as well, in a GP land, you have 10 minutes for each patient, in which again you have to take history, make a diagnosis, and give them a management. And people do get really angry when you're not able to give them. Because, you know, in PLAB as well, we do get stations where it's not very much about clinical, it's about how you meet with the expectations of the patient.
True.
I call them ethical stations.
Yes, right.
Yeah, so so now, because I am working in GP, people do, you know, thanks to Google, people prepared in their mind what they have and what they want from us. So additional time to convince them that, you know, it's not what they think, and they don't always need a medication for a problem they have.
True.
So PLAB 2 is a very good platform, you know, to familiarize yourself with what you're actually going to deal with later in life. So again, yes, after you're done with your PLAB 2, then is when you apply for jobs.
Yeah, so that's main question. Like, so actually nowadays, lots of candidates, they are messaging us, emailing us, and telling that no jobs are there, jobs are not available, we are not finding. So we're just telling them keep on applying. So just we want to know how many jobs did you apply and how many offers did you get? How did it went?
Yeah. So when when I went back after doing my PLAB 2, um, I didn't have any priorities in my mind as to what to apply in and what not to apply in. You know,
Mm-hmm.
um, because I felt that I need to get into system, and once I get into system and once I understand the system, I would get any job I want to. So I can't be putting my options, because that was not the right time. I think where people go wrong is they I would say they put options for themselves,
Mm-hmm.
and they do that, they lessen the options for themselves,
True.
because then you won't be applying for everything that's suitable for you.
Mm-hmm.
So what I did was I applied for everything, be it surgery, be it medicine, be it peds. I had no experience. I did not do my internship in obs and gynae, but I applied in obs and gynae as well, because I needed a job. I didn't want to waste my time.
Mm-hmm.
And it was not that I was lying to them. When I was giving interviews, I told them that I don't have any experience, but I'm happy to come over, learn things, um, and then progress in my career. And they like progressing. They would not expect from you to deal with a cardiac arrest on your first day. They won't expect that. They know that you are new to system, you're new to the environment, and it's your first ever job in UK. So they don't expect big things from you. They are very supportive. So for
Right.
job, yes, I also read a lot of posts where people say we're not getting enough jobs, we're not getting interviews. Just keep applying. Apply in anything that appears on NHS job profile. Another thing I would say is work on your profile as well. Um, Tell them anything that you have ever done, be it a teaching experience, be it a gaming experience, to be honest, because that's what where they try to get to know you, how flexible you are as a person. Because when you're working, they would see your flexibility. They want a flexible person who can work in an environment they are going to expose us to.
Mm-hmm.
So I feel like I put in my job profile, I put in everything. I even wrote that I was a basketball team champion. That was not clinical, but I thought I should be writing that.
Mm-hmm.
So I, I mean, I'm not saying put random things. All I mean to say is, I mean, just express yourself as flexible, as confident as you can.
Mm-hmm.
And experience, yes, do look for experience. They would prefer getting an experienced person. Having said that, they do lack a lot of doctors in hospital. They are always looking for doctors. They are always short staffed.
Mm-hmm.
So there are jobs available, and they are looking for doctors.
Mm-hmm.
What I would suggest is just work on your NHS profile and apply in any job. Do a 2 months or 3 months job, and when you do that, just start applying to the next job where you want to be, or in whatever specialty you want to be, and you will get a job because you're in the system now. And once you are in the system, obviously you will know people. You can ask them. You will have your supervisor. You can ask them to refer to different departments, and you will eventually get a job.
Yeah, that's absolutely right. As Dr. Iqra mentioned, like apply for any job you get, and once you are in the UK, you can easily shift also in the stream which you are interested in. So don't waste time that I just want surgery or I just want medicine. Just dive into it. Just come into and come in the UK and start working in the NHS, and then definitely you can change. And regarding the CV, that's also really good. Yes, put everything. Like even I have seen many people, they have done maybe some audits and some theses and all in their country, but they feel hesitant to add that in the CV. please do it. Any poster, any teaching you have done, whatever it is. And as you mentioned, even you are a spokesperson, put that in your CV. It's going to enhance your CV any day, for sure.
Yeah.
All right.
Yeah, so that's about how you apply for jobs. Then the job interviews. As I mentioned, I went back right after my PLAB too, and my interviews were online interviews. So I didn't do any face to face. In fact, the job I got, it was a telephonic interview, it was not even face to face. So from interview point of view, I would suggest what they are looking for is just be yourself. Don't get confused. If you don't know anything, don't make blunders. Don't say something that would make them think that you are not safe for the patient. The main thing they are looking for in you is if you are safe for the patient. That's the only thing they are looking for. If you say something that's wrong and that's a blunder, that would be a huge negative in your interview. Rather than saying, I'm sorry, I don't know, I would ask my senior. That's, I have felt that, the international graduates, including myself as well, I thought at that time that I should be answering every question. I should be answering. I should not be staying quiet. I should not be saying that I need to ask my senior. And that is how the setting is back in our countries as well, unfortunately. But here it is considered a positive point when you speak up if you don't know anything. So it's good because you're being safe for the patient, and you say I don't know. And you always have senior support in hospital or in whatever setting you are. Even in a GP, you're sitting in a room, but you always have senior GPs, and you can always go and ask them if you don't know anything. So I would say just sound sensible in your interviews. Don't make blunders, or don't try to be overconfident or more knowledgeable as they expect you to be. They're not expecting you answers from you at consultant levels, because you are not a consultant. That takes a lot of experience and knowledge. You are there as a junior doctor. They are very much aware of the fact that that's the first time you're going to be in such a setting. So they don't mind if you be honest with them and tell them that that's what not I have heard of, or I don't know. That's not what. In my interviews, they ask me a lot about audits. I was honest with them. We don't do audits here at our level because we are junior doctors. We don't do audits. We do small projects, small researches, but not actively because we're just part of teams. So having said that, I did read about audits and whole of the process because I knew they would ask me. They are very open about research and audits. So I was able to tell them about the whole process of audit, but I was honest with them that I haven't done one because that's not the opportunity that's available to us here in our system.
Right. That's good. That's good. So that was a good journey that you mentioned. So when did you start applying for this GP training? So I mean, after how many months or years as an SHO or as an FY2? So after how long and how much time it took you to get your FY2 competency signed by a consultant?
Yeah. So I started in Feb, right? So I started in stroke medicine, stroke and neurology in King's College Hospital. Something I had no idea in. And just to let everyone know, I got rejected in this job at first place. My interview went really good. And the email I got was, your interview was really good, but we have an experienced person than you. So we're taking that person, which was fair enough. But I got the the encouragement that I was good enough in the interview. So that was okay for me at that time. And then after that, my priority was in London, but I won't suggest that, because my priority was London because of circumstances. But still, I was applying in other places as well. So I would again suggest apply anywhere, um, any job. So after that, I got an email again that the first person has withdrawn the application. If you're still available, and I got the job. So so
That's
I
great.
so I started with stroke medicine, and only after 1.5 months, my supervisor came to me and said, "Look, we have a job in acute medicine. Would you like to go there?"
Hmm.
So that's what I'm trying to say. Once you get into the system, once you know the system, and once you prove yourself to them that you're confident enough to go into another specialty, or even not confident enough, you are open to learn. Um, that's what they're looking for. They would give opportunities to you by yourself. So right after 1.5, I started in Feb day shift after 4 months. So I started my acute medicine job in I think start of April or May, around 1.5 to 2 months. I started my acute medicine job. And then I again came back to stroke, and then I did general medicine as well. So I got my competencies signed off after 6 months
Okay.
of working. Um, so your competencies, that's your because your house job is your FY1 year.
Mhm.
When you come here, that's your FY2 year. So you have to get your competencies signed off. That's a very simple form that you have to get signed by your clinical supervisor. What you have to make sure is that you are documenting or you are collecting evidence of everything that you're doing,
Right.
because that's what you can show to your supervisor that, look, this is the competency that I have to meet. So I have done that.
Mhm.
I was lucky because I was working with my clinical supervisor. So he was my consultant. He was my clinical supervisor as well. So whatever I was doing, he was seeing me doing.
Right.
So when I ended so I didn't have to collect any evidence because he's the one who had to sign off everything.
Mhm.
So after 4 months, I spoke to him. I went through the form with him, and he was happy to sign my FY2 form off.
Right.
Yeah. So having said that, again, it's not necessary that you have to. It's good if you feel like you have to do whole of your FY2 year for your confident or for exposure to the system. But it does not always take a year for your competencies to be signed off. As I said, it can take 6 months. It can take lesser time if you are confident enough, and you can get them signed off. They are really simple things. They're not complicated things, so it doesn't take time.
Hmm. Okay. Okay. And then when did you start applying for your GP training? So tell us a bit about your GP training application as well. What else was the requirement? And I mean, even you can tell like, so where, I mean, which places did you choose for your training, all those things?
So I started after I got my competency signed off. Um, I applied for I would say around after 7-8 months. I applied for round 2 of GP training. So there are 2 rounds of GP training. There's round 1 and round 2. Round 1 is where you have all the places they are open, and you can as in you can opt any place you want to, and you have more options available for you to choose. In round 2, um, round 2 is leftover from round 1, so you don't get as many options as you have in round 1. To be honest, I applied in round 2 just randomly. I knew I won't get it. I just wanted to familiarize myself with the exam, the application process, and all of that, because I wanted to be ready enough when I actually apply. So first time I applied in round 2, but I was not ready by then.
Hmm.
And because it's a free exam, I thought, let's do the exam, because then when I would be preparing for the exam, I would know what to expect from the exam. And if I get selected, that would be my luck. But I didn't get selected in in first round. So it's, you have to go through Oriel. You have to do your application. They look for your ALS certificate before you start your GP training. So make sure you do your ALS before applying for application, or even after you have applied, before you actually start working as a GP trainee, they ask for ALS certificate.
Right.
So it's a pretty much straightforward online application form that you submit, and while you're submitting your application, they ask for the places you want to choose, and you can choose the places you want to be. I wanted to be around London because I was in London. But again, there were no places in London in round 2 because they were taken in round 1.
Yeah.
So I only applied around London. There were only 3 or 4 places in each area. So I was pretty much sure that it's going to be very competitive. So once I got half of everything, I knew how to do the application, how much time is it going to take, how the exam is like. Then again, I applied in round 1, which was in November. It's around November when round 1 opens for GP training. So again, you fill in an online application form. Once your application is through, you have to give an exam. Very much similar to PLAB 1 exam, interview-based exam. There are a lot of resources available online where you can study it from. Again, time management is a key factor in addition to your clinical knowledge. It's divided into two divisions. One is your clinical area, and one is your I don't know what it is. I don't remember, but it is. It's not ethical. It's how you prioritize the situation.
Oh, okay. I think you're talking about the situational judgment exam.
Judgmental, yeah. Yes. So, and situational judgmental is 40% of the exam, and 60% is your clinical. So even if you are not very good in clinical and you do good in your situational judgment, so you can still do the exam.
Right.
That contributes a huge portion of the exam. Again, you have to study from online sources or from books, whatever you're comfortable in. Prepare for the exam, you sit the exam, and then you get the offer. You get the result of your exam saying that you have passed the exam, and then you get in before Corona times, you get invited for the interview. The interview is not like the official interview type of the thing. It's again pretty much similar to PLAB 2, but I would say less complicated and less stations. So it's a 4-station exam where again you have 10 minutes for each station, and one station is with the relative, one station is with the patient, and one station is with the colleague, and one station is written station. It's not a clinical exam. They won't ask you clinical questions. It's just they would just put you under random situation. It's not clinical at all. Even if it is with the patient, they would come and ask you questions like, say, can I know the blood results of my wife? Something like that. So you have to deal with the situation, keeping in mind if you can reach the confidentiality or if you cannot reach the confidentiality. So stuff like that. It's not clinical based exam. What they're looking for is if you know about the NHS system enough, and if you know rules and regulations enough.
Right. And one of the guys asking, like, how much more difficult is MSRA than PLAB 1? I mean, they want to compare MSRA with PLAB 1.
I would say it's pretty much similar or maybe easier. Similar, I said, because the clinical portion is same, as in the reading stuff is similar. You get it. You get the questions from every specialty. It's not a specialty based exam. Easier, I said, because you have situational judgmental questions as well. So you don't only have to score in clinical. You have something to cover your clinicals. So but some people find situational judgmental difficult because it's a they would give you a situation and then they would give you um, the options where you have to prioritize. So if you're in a situation, say if you get a cardiac arrest call, I would do A, B, C, D, and E. So what would you do at first instance? So you have to then you have to rearrange the options. So the only drawback in that is that no matter if your goal should be that you're putting the first one and the last one right, because that is what matters, your first reaction and what you think is the least important thing to do in a clinical setting. But if you get something wrong in between, you still get the marks, but you lose marks you lose marks as well. So it's difficult from that point of view. I mean, it's difficult to get all the options in a right setting. Yeah. So answering what is easier comparing one and MSRA, I would say MSRA, because by that time you have read for PLAB 1 already. You have 4A to NHS system. You would have some knowledge about clinicals as well, because that's what you're doing every day. And and because you have already seated a similar exam, you're familiar to it. So I would say the GP exam is easier compared to.
Yeah, you're right. Like when we have got the exposure of doing PLAB and a bit of exposure of working in NHS, maybe 1 year or maybe a bit less than that, but still we know the system. So yes, then you might find MSRA easy. So this
Yeah.
MSRA exam, can we do it in the UK or can it be done in some overseas centers as well?
It could be done in overseas centers as well. I did mine in Pakistan both times. Yeah.
Oh, okay.
So
Yeah.
it could be done in overseas as well. When you get after the application, when you get the email saying that we're happy for you to apply for the exam, you the center, so you would know if um, in what places they have the centers available. So I sat both of my exams in Pakistan.
Right. So, as we all know that you're in the second year of training now. So, just want to know in which department you were posted in last 1 year, and now you are working in, I think, a GP clinic, isn't it?
Yeah. So I think the GP rotations are pretty much standard in each deanery. You would only difference is some deaneries give you 6 months rotation, some would give you 4 months rotation. For me, it is 4 month rotation, so I got A&E, and I got in first year I got A&E, orthopedics, and GP. But by the time I was finishing my orthopedic rotation, Corona happened, and I could not move on to my GP rotation, so I stayed back in my orthopedic rotation, and I was redeployed into medicine. So I was working in medicine during Corona times. So pretty much similar settings. The only difference is they would rotation. Sorry, but the only difference is might be a 4 month or 6 month rotation. In my second year, I had psychiatry, obs and gynae, and peds, but not because it's essential in a GP training that you do more than a year of the GP training. So we do have third year is whole of your GP. You are in a GP land. Before third year, you have to do one rotation in GP setting. That's compulsory. So In my second year, I was meant to be doing psychiatry, obs and gynae, and peds, but because I missed my GP rotation in first year, I am now in GP rotation. So I'm not sure which one am I going to miss between these three from psychiatry, obs and gynae, and peds. So I know I will get two of those, but I'm not sure which one I'm not going to get.
Right. Good. And also, like, we do have the GP exit exams as well. I know there have been a few changes because of this COVID, but as you know, like we used to have this AKT and CSA. So, did you try any of these exams? Maybe AKT, or are you preparing for it?
Yeah, so with AKT days, you cannot sit it in your first year of training. It has to be, it is after first year of your training, you can apply it. So AKT is similar, there are no changes to AKT. And then there's part 2 exam, which is CSA. Again, I would say similar to PLAB 1 MSRA, because again, it's an MCQ based exam.
Absolutely. True.
It's not specialty based. Again, you're going to get questions from everything. Only difference is you would the additional questions that you would get is you would get statistics questions and get admin questions, because that is what you have to be familiar with when you go into the GP setting. You would get some portion of that as well, but otherwise it's similar. Again, you have to prepare from online resources. There are online question banks you can buy subscriptions for, and you prepare for it, and it's similar. You just apply for it and sit for the exam. And then is so for you can sit 4 attempts for this exam. But I know people who not do it in 4 attempts and they sat attempt as well. You have support of your supervisors and your DP. So if you give them, a reason why you could not clear the exam before, they give you a chance. But you might not give. That's very much, depends on your circumstances. That's very much individual decision they are going to take. But generally, it's just 4 attempts for each exam, for this exam. And then you do your CSA. CSA has now changed into RCA. That you have to do your video consultation and you have to send it off to them. And then that is similar to what they used to do years ago. So years ago, there was no MRCGP. There was no such exam. It was only video consultation that you would do. You just have to make sure you meet the criteria of everything they're looking for. But you have to do it with the patient. You can't be doing it with anyone. You do it. You make a video of yourself and then you send it off to them, and they mark you on that. That was the whole GP exam years ago. There was no AKT. There was no. It was just a video consultation. So now, because CSA has changed to RCA, maybe the whole of the thing gets changed to RCA only the video consultations. But for now, there is AKT and then the RCA. RCA might get back to normal. That's CSA. So CSA again is patient-oriented exam. You sit with patients, speak to them, give them management, similar to PLAB too. So you pretty much are doing same thing throughout your journey, with the of some minor things, but it's pretty much similar.
Yeah, I mean, I think as the level is increasing because your level is also increasing because you are undergraduate first, and then when you're exiting the GP thing, you are a postgrad, you are a consultant, GP consultant. So the level of the exam will increase somehow. Otherwise, it's similar like PLAB 1 and PLAB 2, you can say.
Yeah, what I meant to say is the setting of the exam is similar. The structure of the exam is similar.
Right.
Obviously, you won't get same questions. The criteria of the questions gets difficult. The marking criteria gets difficult. progress through your training.
Right. That is good. And somebody is asking, one of the user, is it advisable to enter the training without any NHS exposure? Is it too difficult to start the training directly without having any NHS experience?
I would not suggest that. I think I forgot to mention I was meant to be talking about job pressures as well in between. When no matter how confident you are or at what level you have worked in your country, NHS is entirely a different system. Only the computer system is entirely different. So it takes you. I remember when I had my induction, it gave me anxiety. The computer system only gave me anxiety because there was so much to. Because I thought in my mind there's so much to learn for this system only. If I have to look at the blood tests, there's so much detail you have to go into, and the logins, the passwords, where to click, where not to click, and so all of that is online. It's not paperwork.
Right.
So only the computer system gave me anxiety because I thought it's going to take some time for me. So you can't focus on your clinicals when you can't doing administrative work, because you are working at junior level and you are expected to do some administrative. You're meant to do discharges. You're meant to prescribe. You're meant to look at bloods, and that's not a paperwork. You have to go into system to do that. So I would not suggest that because a new job comes with its pressures. So because you are in new system, you are trying to prove yourself, and you have that pressure back of your mind that I have to learn things. I might not make blunders, and then somewhere you are hesitant to ask questions as well. You're okay to they get to come and ask questions as many times as you want to, but you might be reluctant because you don't want to sound dumb. So you have that pressure as well that I don't want to ask so many times. So you're trying to be smart as well. So there's so much going on. It's not just clinical thing you have to face. Some I remember because funny thing, but I could not remember names of my patients because I was not familiar. So everyone else in my team, next day they would remember the name of the patient, they would know what was wrong with the patient, and they would know what is going on with the patient. And me, I was not able to remember the name only because it was different for me. I was not familiar with these names. So I got home and I was anxious that I don't remember my patients, but you're okay at the end. What I'm saying is, first month is difficult for you, and obviously they don't expect things from you because they know that you are not in training and it's your first job in UK and you are learning. When you are in training, you are expected to know things because obviously you are in training. They are still open to teach you things. They are still open for you to make mistakes, not blunders. Yeah, they're okay if you make mistakes. But I would say the expectations at training level is higher as compared to a non-training job. So I would not suggest applying directly into training without having any.
Right. Yeah, that's right. Actually, yes. I mean, this is not only the medical knowledge. You might be having the medical knowledge, but you're not aware of the system. So better to have some idea about the system and then enter into the training post. And also one thing. So, for example, somebody has done their masters in their country, like MDMS from India. So, can anyone from India sign the CREST form, for example? What should be the designation of that consultant who can sign the CREST form?
The CREST form, is it? I'm talking about FY2 form.
Yes, FY2 competency. Yes.
I think it has to be a consultant, and you can get it signed from any consultant.
Okay.
Yeah.
So it means it's okay. I mean, if we get it signed here in the UK or from our country, both are okay.
It does not matter. It does not matter. It just has to be signed off correctly.
Fine.
Someone at a consultant post. It does expire after some time. I'm not sure. After a year, maybe it expires, and then you get it signed off again. But as long as it is signed off by a consultant, it's fine. I think they do get you do have to give your references when you apply for a job. So
Yes.
they do get back to them asking if you have signed this form or if this person was competent enough. So that's fine.
Okay. And one thing more, I don't know, like, are you aware of this? What's the difference between MRC GP UK and international MRC GP? That's the question. I don't know if you'll be able to answer.
MRC GP and international. I'm not sure, to be honest. All I know is that I don't think it matters if you have done any type of MRC GP outside UK, because they would expect you to go through the training process in order to be a GP here. But again, I'm not sure, so I don't want to give wrong information.
You know a bit about this. Actually, a lot of countries, they are doing this MRC GP, this courses and everything. It happens in UAE, it happens in Egypt as well, in Burma as well. They do actually, but it's different if you compare it with the UK. So it's not like if you have done the international GP, it will be valid in the UK. No, it's not like that. The UK one is different. It's absolutely different. So don't compare actually the international MRC GP and the regular one. It's completely different.
Yeah. And I think, having said that, again, I don't know what it is, the international MSRA, but again, I think they would always prefer to have done training here in UK. Again, because you would know the system, you would know how it works. So they would prefer to have that MSRA.
Right, that's good. That's good. So how's your job or training going on at the moment? Enjoying? Stress?
It's good. No more stressed. Having said that, each rotation is a different rotation, because you go in different speciality, you meet new people. Their way of working would be different. What other teams would be working like. You would get familiar. In your past rotation, you would know which printer in the department is working, which printer is not working, where to go to, who to ask, who not to ask. So when you go in a new rotation, it again comes with all of these things. You familiarize yourself again with whole of different setups. So initial 1 to 2 weeks, I would not say stressful, but you should be flexible and open enough to lot of things, to learn things. And once you get hang of everything, it's fine.
Right. I mean, yeah, that is true. It's always, whenever you go to a new place, you have to get some idea, and it might take few weeks. And once you are accustomed, once you are used to them, it's easy. Yeah. And in GP rotation, every 4 months or 6 months, you are changing. So yeah, things a bit maybe tricky. Yeah. Okay. Any message for our viewers, like, oh, those who are interested to come and join GP? Good or very good GP training?
Well, it's very much an individual decision. You know what specialty you have to go into. I would say when I came to UK, I was very passionate, and I was like, I would either be a surgeon or a cardiologist. But when I started working here, I realized that I am spending a lot of time at work. I was doing weekends, I was doing nights. So it's true that when you come from your country into a new country, obviously you want to do something. That's why you're here for. You're not here for having fun. You're here to be something.
Right.
So it's always, and people do get confused between GP and other specialty, because they always have this question at back of their mind, if they would be able to go back to their country and practice in a hospital setting or whatever. But I would say it's an individual decision. I came here very passionate. And I remember I used to speak to Asad. Uh, I used to tell him I want to be a cardiologist. I would do this. I would do that. But um, at the end of the day, I realized that I'm not happy at my work, and
Mhm.
I am spending so much time at work, and I don't want to be unhappy at my work. So
Mhm.
I need to be doing something that I'm happy doing. I was
Mhm.
enjoying it, but again, I had questions in my mind that why I would go to hospital on weekends and I would not be satisfied because I would ask myself, why am I not with my family? Why am I not spending time
Mhm.
with them? So then I chose that yes, I have to be something, but and then again for me, that's again as a person, I feel like my time is very important. I don't want to spend years in a training and then be a consultant. So I wanted to do something quick, and obviously I wanted to be on a post as well. And as GP is 3 years of training, you are earning the same amount as a consultant in a hospital after you become a GP, or even more. Because when you become GP, you are not only a GP, you have more options. You could be a salaried GP, you could be a locum GP, you could be a e-portfolio GP, you could be a partner. So that's all of the options you can explore once you are through all of this process. But yes, you have options, and you might be, if you have earning in your mind, you might be earning more actually than a consultant in a hospital if you're a GP. So that's why I chose GP, because I didn't want to spend my time in hospital over weekends and nights. I wanted a balance between my personal and my professional life.
Mhm.
um, and it was I was earning as much in less time, as other people would after 8 years of training, or maybe 9 years of training. So that's why I chose GP. But again, I would suggest come here, explore things, go to different departments. You don't have to work in every department in order to get exposure. Once you're here, you can always do shadowing or 2 weeks of
Observation, attachment.
yeah, and then you would know what you're liking, and then you're good to go, whatever you want to do.
Right. And any idea about this GP with the spatial interest? How to go with that? Is it like when you apply for the GP, do you have to mention that time, or is something to do after that? So GP with extended roles.
Yeah, so no, you don't have to apply. You don't have to apply differently, or you don't have to mention anywhere. Um, the surgery I am currently working in is a specialized based surgery. So I have in my GP, I have a dermatologist, I have a gynecologist, and I have someone who deal with diabetes. So it's just how experienced you don't have, you it's good if you have done courses or diplomas, but it's more about experience. So
Mhm.
having spoken to so many people, because I'm working with them, all that I came to know is that they had experience. Like the person who was doing dermatologist, he said that he was going. Uh, so when we are in a GP post, we get a half day every week as our study day, or as a shadowing day. So you work half day, and a half day you can be anywhere in hospital or at home studying. So he said I was utilizing that half day going to dermatology clinic.
Mhm.
Um, so I was going there every day. Then I got to know the consultant. I was working with them. They taught me and everything. And he was confident enough, and he mentioned that in CV, and he's working as a GP dermatologist, and he did some courses as well. But that's not important. I think your experience matters, and how confident you are to deal with matters. So you can, yes, if you want, that's good. That's what I have been told to look into as well. You can make up your mind. Like if you want to pursue a specialty, you can always make up your mind. You can get experience in that. You can do courses in that, and you can mention that in your CV. And then when you're working as a GP, first half of your day you would only be seeing specialty patients, and rest half of your day you would be working as a general GP.
All right. Yeah, that is good. I mean, if you want to have, I mean, some says like GP is like a family doctor, but not like, I mean, it's not only that much. You can have the roles, like extended roles. You can have your special interest, and you can have patients only from that branch as well.
No, I think it depends on your exposure within your experience because my country, they are doing abscesses as well, doing microsuctioning as well. The dermatologist he needed
Yeah.
therapy as well. So it's not really a general setting.
Yeah.
I was shocked when I saw all of these happening in the setting. So, but it's happening. So you always have that choice as well.
Right. So, I mean, yeah, I mean, you will be having lots and lots of things in the GP. And, you know, many people say, I mean, if you love yourself, go to GP because of less hectic and you will be having your life as well in the GP.
Yeah.
That's the main thing. Good, good. So I think we have answered, I guess, all the questions as well. And I must say thank you so much, Dr. Iqra. It was a really wonderful session from the beginning, from IELTS till the GP. I think we have given, or you have given them the overview of everything. So it was really a wonderful session.
Thank you so much. No, thank you for this opportunity and providing this platform for so many people out there who would, I'm sure, get some overview, or this would help them in making their mind to what they're expecting if
Right,
they're
right.
getting it. Yeah.
Yeah. Yeah, I mean, yeah, these kinds of interview like can help those people, like those who are in that deciding phase. So whether I should go with that or this, so it might be helpful for those people. These kinds of interviews. Great. So any, I mean, our viewers, those who have any questions and all, you can just put in your in the thread on the Facebook, and we can answer those questions later on as well. All right.
Yeah.
So thank you, Dr. Ikra. Thank you so much.
No, thank you, and most welcome.
All right. So I'll just end the broadcast.